Thank you so much, Dr. Najmi, for coming to our podcast today.
My pleasure.
Yeah, we are thrilled to speak with you today. Can you speak more about yourself, about your specialty, about your background, and where are you working here?
Sure. I am originally from Turkey, but I'm coming from UK. I was working as a consultant in obstetrics and gynecology back in UK
Wow.
in Gloucester Royal Hospital, and I moved to UAE 2 months ago. At the moment, I'm working as a consultant, obs and gynae in NMC Royal Hospital, Abu Dhabi.
Wow.
I had my initial postgraduate training in Turkey, but in 2015 I moved to UK and I recompleted my training in obstetrics and gynecology in UK.
Very good.
So I was working for NHS,
Mhm.
and then I made a decision to come here.
So, what make you take this decision to come to UAE or Abu Dhabi?
So I was very grateful for the opportunities which I had in UK, and I had great colleagues and friends and a life there. My subspecialty was laparoscopic surgery, hysteroscopy, colposcopy, which means treatment and diagnosis of precancerous changes in the cervix. And also, I had special interest cosmetic gynecology, and I was practicing in labor ward as well. My advanced training also involved advanced labor ward management, which was difficult deliveries and cesarean sections, complex operative vaginal deliveries. However, it was very difficult for me to have an ownership of the patient. I would like to follow my patients and see the same patient reasonable duration of time, for instance, not months ahead, but I would like to know how they're doing, and I would want to, if they need an operation, for instance, pretty quickly. Not, I was feeling a little bit bitter about these patients had to wait to see me for months and not able to see at all, or not able to treat them timely. I mean, NHS is a great system and everyone there is working so hard to provide the best care for the patients. But pretty quickly after becoming a consultant, I felt like that's not the right job description for me, working there like that.
So, what is the different here?
So here I work in private, full private, corporate hospital, and they are very supportive, and they would like doctors to take the responsibility and ownership of their own patients, and they provide everything they can is clinic-wise, operating theater list-wise for us to look after our patients, and patients are more satisfied with this system as well. And I can see a patient in my clinic, and pretty quickly, within a week, if they need a procedure, I can book it in our operating theaters. Or if they need a follow-up, they can find a slot very easily and so quickly. And I get to know them in person. I know their job. I know where they're coming from, their family. And it really thrills me because I love my job. And I think empathy and getting to know your patient sometimes inside out is so important to understand what they need and what they look for their health and healing.
Very good, amazing. So you are working now in NMC Royal Abu Dhabi, and you have 2 months now.
2 months only, yes.
So what is your first impression coming here?
So first of all NMC hospitals aiming for high quality care, and they are very aligned with European British guidelines, and they are very safety, quality, and governance is very important for NMC hospitals. And in order to achieve those goals and maintain the high quality of care, they are promoting their doctors coming from abroad, especially from UK, to participate in this governance processes. For instance, 2 weeks after I started, I was sent as a representative doctor to DOH maternal and neonatal improvement plan workshops. So I was representing my hospital in 2 weeks, and I found it really supportive. You feel so involved in patient safety, which makes me feel like I made the right decision, because I wouldn't like to work somewhere who doesn't put the patient safety first before finance, I would say.
Very good. Yeah, so Dr. Najmi, you are originally from Turkey.
Yes.
Then you moved to UK. Then you are here in Abu Dhabi. So most of the doctor I speak with them, they all hesitated to relocate one. You did it twice.
Yes.
So what you can say to this doctor who's they aiming to come here to Abu Dhabi and they are hesitated, not Abu Dhabi, like in UAE or this region?
Yes, I think that's my personality. I like challenge and I like changing place. I feel like it is expanding our ability to think and progress in life and keep us young. And it never appealed to me to go to same hospital for 20 years and working in the same job plan.
Yeah.
So I think personally, I didn't find decision very difficult. But of course, I thought about it and I had hesitations time to time. But sometimes those hesitations can prevent you having progress in life. And I was very lucky, your qualifications in UK doesn't go away like that. And I thought in the worst case scenario, if I can't make it, I can go back to UK or in Turkey because I trusted my training I had in UK and Turkey, and I trusted my ability to look after my patients, and I felt like this would be appreciated anywhere in the world. If it comes, your question was about UAE. How is it like to be in UAE? Because I'm coming from Turkey, it's not an entirely different culture. And it has very similarities. And when you are trained in UK, you become a part of a multicultural community at a hospital and outside hospital. And here is very similar. Many people here are expats. They're here for working. What I noticed difference is people here are very hardworking and their job is so important for them and they are giving 100% of their time and effort to do their job in a good way. So after I came here, I realized that this was the right decision. My hesitations were like very minimal because I'm a brave person to make decisions for changing lives.
So when exactly you take your decision? I hear you speak with Emily outside about like Emily keeping like calling you and you said like it's not now. So when exactly you like take your decision?
Yes, it was a process. About 3 years ago, when I was a registrar still, I had a friend working in Dubai, and she was working in a small clinic in Dubai. But she seemed to be so happy, and I think being happy and satisfied with your job is very important wherever you work. And I was talking to her, and she's highly recommended Emily. She said, actually, I used another agency, but use Emily and her agency to come to UAE because they only work with very reliable corporate institutions and hospitals, and they follow their doctors' licensing process very vigorously and meticulously, and you can trust them. You can trust them, and they're not going to make you upset during this process. So Emily and allocation was always in my mind. I had a friend here who was a CEO in one of the corporate hospitals in Abu Dhabi, and I talked to her as well. So I was thinking that she would help me, find a job, and she did. I had an interview with an hospital, but it was never like the allocation assist process because allocation assist has teams in licensing, in advertisement, and even preparing your profile. There is a team for you preparing your CV. And as soon as I saw that my friend cannot really help me, I contacted allocation assist, and I was a consultant by then, and I was having doubts about, is this what you want to do for the rest 20 years of your life? And I said, no, I want another challenge, and I contacted allocation assist.
Very good. And how was the license process? Like, did you find it like difficult?
It was very smooth, and I think UK certifications and qualities makes the process very smooth because the very one thing UK is great. I think NHS and training is very structured, and they make sure that you know what to do. Even if you're taking a history from a patient, it has standards. And I have to admit, I didn't work many places in the world, but I don't think it is like that everywhere. And once you have a training from UK, licensing process here is much easier, and we are lucky. I mean, we are accepted here as a consultant, so we have more privileges to do things, for instance, as surgery wise, consultation wise, and because our certifications and qualifications and skills are recognized here, with the help of allocation assist, it was very smooth. It didn't take years, months. And all I did was you were sending the list of documents I need to upload, and I was doing that. And yeah, that was very smooth. I didn't have the hustle.
Yeah, very good. And how is your first 2 months here in UAE? You actually coming in the best time in
Yes,
in
I
UAE.
know.
Yeah.
Best time, not very hot.
Yeah.
Yes. And it is, in fact, great because I was spending a lot of hours at my hospital, my trust back in UK. But the rest of the life was not as smooth and easy as in UAE because here, yes, I work 6 days a week. Yes, I work long hours. Yes, I have to come to hospital for my patients in the middle of the night, but I love it because the rest of my life is pretty easy, you know. It's a very peaceful and clean and safe city, Abu Dhabi is. And there is always someone for something may challenge you. Dry cleaning, cleaning the house or cooking. And, you know, those kind of things takes time. And I was not very keen to spend my spare time for this. I wanted to, for instance, read the new updates in my profession. And you're exhausted if you need to cover that kind of aspects of life outside hospital, but you don't have to in Abu Dhabi, and people are very kind and helpful to you. There are problem solvers here, not creating problems at all, and they try to make your life easy. It's the same in my hospital. My head of department and my hospital director, my colleagues, they are all supportive. They want you to achieve. They want you to practice, build your practice pretty quickly. And there's a big Turkish population as well in UAE. And when they get to know there's a consultant working in NMC, they look for where you work and they come to see you. And it makes me so happy because at the end of the day, it's my native language. And my people, when they speak in their native language in Turkish with a Turkish doctor, Turkish speaking doctor, they feel more comfortable. They feel like more understood.
Yeah, this is correct.
Yeah, they can express themselves very.
Yeah, very good. And you also come with your mother. So
Yes.
your mother is here.
3 months.
Yeah. So I'm usually when I speak with one of the doctor like from outside, they are like they have some problem to bring their parents there. So how is to bring your mother here?
First of all, I didn't bring my mother here.
Okay.
She just came to support me for the first 3 months. But even so, it was so easy. In another city, probably people would think that, my mother is 73 and they might hesitate to bring someone. So is she going to be okay? How is going to be like, moving process? Is she going to struggle? First of all, moving was so easy. I used an app to see the suitable apartments before even coming here. And my hospital picked me from airport with my mom and arranged an accommodation for my mom and me for the first 2 weeks until I settle in an apartment. So it was very easy. My mom was very happy. And we had just to give an example, we had a little issue with her health, a skin condition. And I talked to my hospital. I brought her to hospital, had a consultation, and pretty quickly she had her treatment. And I know that it wouldn't be the same in UK. We had to go to GP and then, those kind of things. And I felt really safe for my family. If I had a family, I would be very safe to bring them here. Of course, she's going back at the end of this month, but my genuine advice would be they shouldn't hesitate. I'm pretty sure they're good as well because the Turkish population or expats or locals are from here. So the example should come from expats, right? So the Turkish population I talk here, they're very happy. Some people say that we never want to go, but we have to go because there's no such citizenship possibility. But they're so happy here and they have children. So
very good.
yeah.
Okay, Dr. Najmi, thank you so much for coming
You're
today.
welcome. My
It was a
pleasure.
pleasure
Thank you for
speaking with you.
inviting me.
Thank you so much.
Thank you.